Hey, everybody, and welcome to another episode of the Patient Convert podcast. Justin Knott here, and today we're talking plastic surgery, cosmetic surgery, marketing. I wanted to go over some of the trends that we're seeing with our plastic surgery and aesthetics practices, and what's really kind of moving the needle to reach patients with development in AI and paid advertising and SEO and just kind of all of this stuff. So I really wanted to break down today what is going to be most effective if you are a plastic surgery practice and you're either out there marketing or you're looking to grow the rest of this year. Number one is SEO. I mean, SEO is really king, and king of that is content. Content is the biggest driver of local search rankings for what is a super, super highly competitive space like plastic surgery. With it being cash-based and elective, you have to win the top 3 search results. Really 2 areas of search that you need to be focused on. One, off page, which is Google Business Profiles, making sure that that is optimized as well as integrated into your website is absolutely critical. For every location, you need a location page, and for every location, you need a Google Business Profile. Those 2 married together is really what's going to drive all of the near me searches for all of your surgeries and med spa based treatments that you're focusing on growing. And that's really, really critical. But it starts with on-page optimization and content optimization. If you listen to the podcast, this is something that I can kind of constantly reiterate, but a content program really is the foundational piece to SEO and winning search, especially if you're in a major metropolitan area. It really is the key driver to everything we talk about when it comes to search engine optimization. So you really need to focus on, especially as you get into really competitive spaces of the different types of surgeries that you provide at the practice, it's all about just masterfully written and structured content. And then things like video sitting inside of that content, because there's no doubt about it, patients prefer to watch video versus reading, but there's also no doubt about, in the day and age, even in 2023, that Google wants content in terms of a ranking for SEO. And so you need to be addressing both. You need to be able to address the patient experience on the website through video, but you need to be able to have that written content if you're going to rank high enough in local SERPs to drive patient traffic, convert them as leads, and ultimately convert them as a surgery in this case. And a lot of times it's going to take 1,500 to 2,000 words. A way to balance that is really going to be looking at traditional treatment structures of kind of the what and whys, like what is a surgery, how is it performed, what are the recovery times, all that stuff kind of at the top half, which would be more of a traditional treatment model, and then using FAQs to your benefit in the bottom half to answer a lot of the long tail search query pieces that patients are going to be searching for. You can also, that's where the blog can come in. The blog can be really effective in addressing some of the, like, what is the cost of a breast augmentation, like those types of things. But again, you really want to have the augmentation page be the center point. We'll call it a skyscraper technique or a cornerstone piece of content to rank. If you do a local search for any of the treatments that you offer at a plastic surgery practice in a near me kind of geographical based scenario and search, you're going to see long form, well-structured content ranking. And that's really, really, really essential if you're going to win the search game. On top of that, a lot of people look at, well, Google Business Profile is driving most of the traffic nowadays, which is true in a near me search. Google's heavily vested in that space, and reputation has a very, very big impact on ranking and winning in that space. So you certainly need to be investing in proactively automating a process to generate new reviews, both video-based patient testimonial reviews, especially in the space that we're talking about. But when it comes to Google Business Profile, you need those written reviews, those user-generated content pieces that are going to drive your Google Business rankings. But where people miss out is the way that you expand the visibility of that Google Business Profile in terms of all of the different treatments and conditions that it ranks for versus just like plastic surgery practice or plastic surgeon near me, is all the content that's back on your website. Because it actually gets, Google Business Profile will get associated with those content pieces and allow you to increase visibility and rank your Google business profile for all of those conditions and treatments that you may not normally show up for because you don't have content on your website for it. So that's why it's so critical to be constantly thinking about how you're creating the most awesome conditions and treatments library on your website around all of the both ends of the spectrum, the things that the problems you're solving and how you solve them, so to speak. And that's really, really critical. The other obviously major piece to this is ads. Ads is really, really big in the plastic space. It's also highly competitive and can be highly expensive if you're not careful. The benefit, though, is your CPL, your cost per lead, and your CPA, your cost per acquisition, or an actual patient like becoming, or an actual lead becoming a patient. You have obviously a lot more wiggle room there in terms of being willing to pay a higher premium on those leads. And as long as you're converting them, especially paid ads leads, you'll typically convert organic search leads at least in the 35 to 40% range or higher. That's why it's usually the highest ROI long term. You really want to invest in organic SEO for the long haul and win that in your market, but supplement it with paid ads and a really strong paid ads funnel that involves automation and other pieces to get people over the finish line. But that's typically going to convert in the 20, 25%, 30 if you've got really good front office salespeople that are really experienced at selling the value of your surgical practice and the outcomes and the differentiators and the luxury brand and all that type of stuff. Then you can get up in that range and then you're really killing it. But again, looking at that, it may look expensive on its face, but if you're doing a really good job from an advertising standpoint, using search ads and programmatic display advertising, you really should be able to get in front of the right type of patient with the right type of buyer profile and buyer intent and get them into the lead funnel and then convert them for a treatment or condition, or just at least get them in the office so you can meet with them and do a paid consult. And that's really, really critical. Search ads are I think the lowest hanging fruit because you really can target exactly the type of things that a patient is searching for in your geographical area. And then you can optimize for those conversions. You just have to be careful with all of the kind of evolving guidelines in terms of third-party pixels and the inability to put BAAs in place. That you're not tracking PHI incorrectly. Again, it's a little bit different with non-insurance based practices, but you really want to make sure that you're paying attention to that, or the agency you're working with is paying attention to it very closely. Programmatic is the other big piece. If you're a plastic surgery practice, you absolutely should and need to, if you haven't, invest in video. You need commercial-based, commercial-ready video to leverage in programmatic display, and specifically through over-the-top and connected TV, OTT, and CTV television conduits to place your videos very strategically in front of the right type of audience based on either demographic information or behavioral and addressable geofencing information, like where they go and where they hang out, to be able to create an omni-channel. And what I mean by that is be able to have touch points across multiple devices and multiple mediums, leveraging video, still, graphics, those types of different things to get in front of them and stay in front of them, and then track that back all the way to an actual visit at the practice. That's really, really big. I think OTT and CTV have really opened the door for a major channel of focus for plastics and cosmetic surgery practices to focus on, but it all starts with assets. Is you got to get those video assets created. 1 minute, so 60, 30, and 15 second are going to be the ones that you want to leverage depending on what your focus is, and if you're using it for remarketing, cold audience, all of that different type of stuff. And it's just it's so powerful because not only versus traditional like commercial style where it was very difficult to track, it was very difficult to attribute leads and the cause and effect of the investment into like a Comcast or something like that. Not only can you track that back, but what you're going to see is a really big correlation to your performance in your Google ads improving. So you're going to lower your CPL, you're going to lower your CPA, because people are going to see those video-based ads. They may not directly convert on them, but they're going to go to search, and you're going to see your branded search terms for the ad campaigns focused on your brand increase and more conversions coming through there, as well as some of the things that you're talking about in your video getting searched, and then again, them converting in ads. So that's really, really important that you're looking at programmatic display if you haven't already, because it is a fantastic way. And one of, I think, the biggest trends in medical right now, especially the aesthetic space, is get video and get up there and begin an omni-channel advertising approach, because it's going to benefit all the things that we've talked about. It's going to benefit your SEO. It's going to drive people to your Google My Business to check out your reputation. It's going to drive them to search to convert them on ads. All of these different touch points, which are really, really critical nowadays in terms of advertising and marketing. And last, certainly not least, is in the conversation of video is obviously social media. This has been a conversation, an obvious one at this point as an aesthetics practice, is you need to be investing in a really strong, consistent social program on the major platforms like Facebook and Instagram, TikTok, if you're going after a younger population, those types of things. But you need a video mechanism to do that without overcomplicating it. We have a tool called Capture MD that will allow you to create video at scale, like 90-second videos that are MP4 ready to go on any major social platform. But again, it's all about planning ahead and planning for success. Failure to plan is planning to fail. And that is the truth when it comes to video, especially for a busy surgeon in a cosmetic practice, is you need to be planning 2 to 3 months ahead. What are the themes? What are the topics? What are the pieces of content that we want to create? What are the demos that we'd like to get? Are we going to get micro or macro influencers involved? Those types of things. So you're building a video program far in advance that allows you to get those assets, and then you're just focused on engagement and reach and ultimately driving people through the door. And that's what it's all about. You got to plan ahead with social content, and you got to be investing and focusing on video. So those are some of the major pieces of the puzzle, I think, right now for plastic surgery marketing and growing your plastic surgery practice and generating more leads and ultimately more surgeries. So I hope you enjoyed listening today. Thank you, as always, for tuning into the Patient Convert podcast, and I will see you on the next episode.